Hi everyone, and welcome to another case scenario here. This case scenario is going to be called Victoria. And as always, I want you guys to keep in mind that every case is different, and this is only one of many possible scenarios. So just keep that in context that this is just one case with many possibilities, and there's going to be, no right or wrong answer. So really, when the case stops and you are allowed to respond to some of the questions, just make sure to respond naturally, normally, how you might respond in any case. There are no, again, right or wrong answers. So this case, again, is going to be called Victoria. It's a pseudonym for this patient in this case. So to start off, a 23-year-old Hispanic female presents to the emergency department complaining of severe stomach pain and light bleeding. She also has a gash on her hand from which is written down on a form that you see as it being from a garden accident. Her brother-in-law is accompanying her to this appointment, and he explains that he's concerned about her and has her ID with him in order to verify her age and her identity. So let's stop and respond here. Just based on these initial few things, what are some things that you notice? And is there anything that you're curious to know more about or questions you want to ask? So continuing on, the patient says that she does speak some English, but looks to her brother-in-law to answer most of the questions that are asked. He says that he is answering for her because she is in a lot of pain, and he also really knows the details of her symptoms. He also said that she has not been to a doctor recently because she does not have insurance, so that's why she has, waited till this point to seek help. The ER that you're working at now is slammed, and there isn't a lot of time to find a translator. So given the time constraint and the pressure you are under currently, what do you do? And obviously this is thinking about what would you actually do in this scenario, even if that's different than your ideal world. So what would you normally be able to do here in this situation? Because the reality is that obviously in ER settings and even in urgent care sometimes the time constraint is a real factor. So you look at her and you try to ask her the questions and tell him directly that you would like to hear from her. However, he interjects and addresses you directly, saying she is embarrassed to talk about this kind of stuff and he would prefer to answer for her and she would prefer that he answer for her. Despite your ask, though, he continues answering questions for her. He has his hand on her upper shoulder, and you notice that. He says that her period began 3 days ago, but she has been complaining of heavier than normal bleeding and cramping. So again, let's take a moment to respond. You want to get the patient alone in order to ask a few more questions. How would you as a provider go about this? Maybe your hospital or clinic, wherever you work, has a policy already of how you could do this. Maybe it's a new and innovative way that you're thinking about how you could get this patient alone when it's clear that he doesn't want to leave her side. So in this case, you end up telling the patient that you need a urine sample, and the hospital policy is that patients go alone and unattended to get the sample. You say directly to him that she'll be right back. And although the brother-in-law does look hesitant, the patient stands up quickly and follows you. Okay, so now you have this moment, you have this space where you're alone with the patient. Once you have the patient alone, what do you ask? Remember, the English language here might be limited in this specific case, not always, of course, but in this specific case, and you have a limited amount of time. So you end up asking the patient, do you feel safe at home? And she says no, but nothing else. She also comments that that is not her brother-in-law, but it's actually her employer. So what is a follow-up question that you can now ask, or that you would now ask, given the fact that she said she felt unsafe and that was her employer in the room not her brother-in-law. So in this case, you can ask, can you come and go as you please? Or this is what you decide to ask. And she states that she must work 12 hours a day, providing childcare and cleaning in order to earn her room and board, as well as the food that she eats in the home that she is working in. She says that she is very stressed out because she hasn't had a day off in the past 3 weeks. She also states that she is unsure how much debt she has left to pay off because she does not earn any take-home pay, so they're not giving her any money. It's all going towards her room and board and her meals. So what conversation do you have with her now, or maybe what resources do you offer her? So this is based on a real case study. And this patient actually, in this case, ended up talking to a social worker and wanting to report to law enforcement authorities. Again, that is oftentimes not the case, but in this specific case, that is what the patient wanted. So there was a trial in this specific case, and testimony was actually given by the healthcare providers who had worked with her and observed the behavior and recorded some of the responses and things like that. So as it turned out, she had been subject to both labor and sex trafficking for the past 3 years. She was able to use the T visa, which is for foreign national victims of trafficking in the US. She also had repeated injuries inflicted on her by her traffickers. So there were actually two traffickers in this case. They, the injury was, when she came in, was stated as a garden injury, but they actually smashed her hand with a rock, beat her with a wooden fence post, and kicked her in order to injure her so that they could get opioids prescribed. So I know that wasn't a part of maybe your thoughts throughout this case, but the traffickers actually inflicted pain on her in order to take her to the ER in hopes that they would get an opioid prescription and then take it from her. So in each instance that she went to the ER for these situations, her traffickers, one or the other, in one case both, were actually with her in the clinics and hospital settings. But it wasn't until this last setting that they were able to get her alone, ask her the kinds of questions they did, and then actually proceed to getting law enforcement and social work involved. So that is the end of this case. You'll be asked to kind of reflect on some of your thinkings here, some of your thoughts. You can go back and change your answers to these questions if you want to. But again, remember there's no right or wrong. And so whatever you put down is just fine. It's just important that we're more so using critical thinking to think through these cases. So thank you for watching.